Good evening, class. Today, we will be diving into the fascinating world of medical nanotechnology and its impact on the treatment of allergies and asthma. This cutting-edge field has the potential to revolutionize the way we approach these conditions, offering targeted and personalized therapies that could significantly improve patients' quality of life. So, without further ado, let's explore the vast realm of nanoparticles in medicine. Nanoparticles, as the name suggests, are tiny particles ranging from 1 to 100 nanometers in size. Due to their small dimensions, they possess unique physical and chemical properties that differentiate them from larger particles and bulk materials. These properties, such as high surface area to volume ratio, tunable surface characteristics, and enhanced stability, make them highly desirable for various biomedical applications. In medicine, nanoparticles are employed for drug delivery, diagnostics, and imaging purposes. By encapsulating therapeutic agents within nanoparticles, drug delivery can be targeted to specific sites in the body, ensuring higher efficacy and reducing systemic side effects. Nanoparticles can also be designed to carry imaging agents, allowing physicians to visualize disease progression more accurately. To understand the potential impact of nanoparticles in allergy and asthma treatment, it is crucial to comprehend the underlying pathogenesis of these conditions. Allergies occur when the immune system overreacts to normally harmless substances, such as pollen, dust mites, or certain foods. Asthma, on the other hand, is a chronic respiratory disorder characterized by airway inflammation and hyperresponsiveness. The complex cascade of events leading to allergic reactions involves the activation of immune cells, release of inflammatory mediators, and subsequent recruitment of inflammatory cells. In asthma, the airways undergo structural changes due to chronic inflammation, leading to increased mucus production and airway constriction. Identifying suitable targets within these pathways presents an opportunity for nanoparticle-based interventions. One of the most promising applications of nanoparticles in allergy and asthma treatment is targeted drug delivery. Traditional administration routes, such as oral ingestion or intravenous injection, often result in low drug concentrations at the desired site of action, necessitating higher doses and increasing the risk of systemic toxicity. Nanoparticles offer a solution by enabling targeted delivery to specific tissues or cells involved in the allergic response. Surface modifications of nanoparticles can be tailored to interact with specific receptors or proteins present on the target cells, enhancing drug uptake and reducing off-target effects. Additionally, nanoparticles can protect encapsulated drugs from degradation, improve their solubility, and control their release kinetics, ensuring sustained and controlled drug delivery. Immunomodulation, the modification of immune responses, plays a crucial role in allergy and asthma treatment. Nanoparticles can be designed to modulate the immune system, either by enhancing or suppressing specific immune pathways, promoting immunological tolerance, or subduing exaggerated immune responses. Manipulating immune cell interactions and the release of inflammatory mediators are possible with nanoparticle-based immunomodulatory strategies. By tuning the physicochemical properties of nanoparticles, such as size, shape, and surface charge, researchers can influence their uptake by immune cells and subsequent immune responses. For instance, nanoparticles can be functionalized to target dendritic cells, key players in immune regulation, and modulate their activity to promote allergen tolerance. A major breakthrough in allergy treatment lies in allergen-specific immunotherapy, a strategy aimed at inducing immune tolerance to allergens by repeated exposure in controlled doses. Nanoparticles can be utilized to enhance the effectiveness of allergen-specific immunotherapy by encapsulating or conjugating allergens and delivering them in a targeted manner. The use of nanoparticles provides several advantages, such as protection of allergens from degradation, sustained release of allergen doses, and controlled presentation to immune cells. Furthermore, nanoparticle-based immunotherapy can be combined with immunomodulatory agents, adjuvants, or immune modulators, boosting the overall treatment efficacy. Bronchodilators, such as beta-2 agonists, are commonly prescribed medications to alleviate airway constriction in asthma. However, systemic administration of bronchodilators often results in poor targeting to the airways, limiting their efficacy. Nanoparticles offer a potential solution to improve bronchodilator delivery, leading to better therapeutic outcomes. By encapsulating bronchodilators within nanoparticles, their solubility can be improved, reducing the need for high drug concentrations. Surface modifications of nanoparticles can be tailored to specifically target airway cells, facilitating enhanced drug uptake and prolonged drug release at the site of action. These advancements hold promise in achieving improved bronchodilation and reduced systemic side effects. Pulmonary drug delivery is an attractive route for the treatment of respiratory conditions like asthma. The lungs provide a vast surface area for drug absorption, allowing for rapid onset of action and minimal systemic exposure. Nanoparticles can be used as carriers to transport various therapeutic agents to the lungs, ensuring efficient delivery and enhanced efficacy. Nanoparticles designed for pulmonary drug delivery should possess characteristics such as optimal size for deposition in the desired lung regions, sustained release kinetics, and high stability to prevent aggregation or clearance from the airways. Inhalation devices can be employed to ensure precise and controlled administration of nanoparticle-based formulations, enabling personalized treatment options for patients. Mucosal vaccination offers several advantages over conventional injection-based vaccination, such as enhanced immune responses at the mucosal surfaces, where most pathogens enter the body. Nanoparticles can serve as powerful tools to improve mucosal vaccination strategies and facilitate the development of effective vaccines against respiratory pathogens. By encapsulating vaccine antigens within nanoparticles, their stability can be improved, and controlled release can be achieved. Surface modifications enable targeted delivery to mucosal surfaces and enhance interactions with immune cells, promoting stronger and longer-lasting immune responses. These advancements open new avenues for the prevention and control of respiratory infections. Inhalable nanosystems hold tremendous potential for sustained drug release and prolonged therapeutic effects in the respiratory system. By designing nanoparticles with appropriate release mechanisms and surface modifications, controlled drug release can be achieved, reducing the frequency of drug administration and improving patient compliance. Nanoparticles can be engineered to respond to specific triggers present in the respiratory environment, such as pH or enzymes, allowing for site-specific drug release. Additionally, the encapsulation of drugs within nanoparticles protects them from degradation, a crucial factor for achieving sustained release and therapeutic efficacy. To ensure the safe and effective utilization of nanoparticles in the respiratory system, it is essential to assess their stability and biocompatibility. Factors such as particle size, surface characteristics, and formulation play vital roles in determining nanoparticle behavior and interactions with various biological components. Stability assessments must consider factors such as nanoparticle aggregation, dissolution, and clearance rates. Biocompatibility evaluations involve assessing potential immune responses, toxicity, and long-term effects on lung function. These investigations allow researchers to design nanoparticles with optimal properties, ensuring their safety and efficacy when applied in clinical settings. While nanotechnology holds immense promise, it is crucial to address potential toxicity concerns associated with nanoparticle-based therapies. Nanoparticles can interact with biological systems in complex ways, potentially inducing adverse effects on cells, tissues, and organs. To ensure patient safety, rigorous toxicity evaluations are necessary. Screening assays, animal models, and clinical studies aid in assessing the toxicity profiles of nanoparticles. Factors such as nanoparticle composition, size, surface charge, and dose need to be taken into account during toxicity assessments. Understanding the potential risks associated with nanoparticle-based therapies allows for informed decision-making and the development of safer treatment strategies. The field of nanoparticle-based allergy and asthma treatment is continually evolving, with notable recent advances and promising future prospects. Researchers are actively exploring novel nanoparticle formulations, targeting strategies, and new therapeutic approaches to overcome existing challenges. Advancements in nanotechnology, such as the development of multifunctional nanoparticles and the incorporation of advanced imaging modalities, offer opportunities for improved diagnosis and therapy monitoring. Furthermore, the integration of artificial intelligence and machine learning algorithms allows for personalized treatment regimens and optimized therapy outcomes. In conclusion, the utilization of nanoparticles in the management of allergies and asthma holds immense potential to transform patient care. From targeted drug delivery to immunomodulation strategies, nanoparticles offer unique advantages in terms of enhanced therapeutic efficacy, reduced systemic side effects, and improved patient outcomes. As the field progresses, it is essential to continue exploring the stability, biocompatibility, and potential toxicity of nanoparticles, ensuring their safety and efficacy. By harnessing recent advances in nanotechnology, researchers and healthcare professionals can pave the way towards more personalized and effective allergy and asthma treatments. Thank you for your attention, and I look forward to answering any questions you may have.